Okay, your back just went out. What do you do? My name is Tom Wellman. I'm from Apex Orthopedic Rehabilitation. I'm going to give you a few easy steps during the course of this video on how to work yourself through maybe taking care of the back and getting a little bit more comfortable. Might not be the solution. It's just trying to avoid that emergency visit to the doctor or the emergency room, and give you a little bit of some tips as far as steps you can take that are very easy and you can do at home. So let's go through those. So the common scenario that people experience, and it'll sneak up on you. It could be from a long car ride. You get out of the car ride, you're going down, we're right by the Jersey Shore, you get out from a long 3-hour ride and boom, you all of a sudden feel this back pain. Oftentimes, you don't even feel it while you're in the car. It's actually getting out of the car. It can also after be binge watching Netflix, Umbrella Academy, whatever is your favorite binge, and getting up and having that immediate bang of pain. A lot of times what will occur is you'll actually feel like you're almost in a C kind of position. So what happens is you get out of that sofa, you get out of your car, and all of a sudden you can't stand up. This is with folks that are having a hard time standing up. They feel like they're kind of spasming, they have pain here. They may even have pain radiating down their legs, and they can't quite stand up. Now just remember, you should not try these steps if you have anything called red flags. So let's go over this real quick. So red flags, you have any changes in bowel and bladder, like can't hold back your urine, you all of a sudden can't have a bowel movement, you're really getting weak really rapidly, okay? Any movement actually starts creating more pain, you can't, like unrelenting pain, you may have to go to the doctor right away. So I'm just saying you can try this as long as these exercises make it feel better and you actually start moving better, okay? That's very important. Okay, so you're in that C position, you just got out of the couch or just got out of that long car ride, okay? And you're kind of in this position right here. I call this the C, okay? We're sitting down, we're in a C position, okay? In that position, we're in too long. Big trigger for lower back problems, one position. Static posture is too long, one position too long. So what we're gonna try and do in this video, I'm gonna show you the next steps, is reverse that C very gently. Because if you'll notice the people that can't stand up, it's just too much pain, they have to basically do a stretch or a gentle movement without being in weight bearing. When I have the weight through my body and my lower back, it's hard to move. So we're basically gonna try and get you on the table. I'm gonna show you that next. Get you on the table and slowly move you to the point where we can at least stand up and be able to move a little bit better, okay? That's the next step. Okay, so the first thing we wanna do, now we're in that forward position, okay? I can't stand up, all right? Let's say, for instance, I have lower back pain, spasm in this area, and it's going down to my buttocks or mid-thigh, okay? As we do these movements, if the pain starts coming up and it's just in my back, it's a good sign. If you have pain in your thighs, like this is the furthest area where the pain is, it's no further down the leg, as you do these movements, if the pain starts radiating down, you have to stop. So pain going to the source of where we think the pain is, better. Going further away, bad, okay? Simple thing, bad or good. If it's bad, you stop, contact the doctor, ER. Okay, so we're in this forward position. The first thing we want to do is we want to try and accommodate this forward position. We want to get on a bed, most likely. I have a table here. The floor is kind of hard because it's hard to get off of it if you can't change the back situation. So I'll have people take a couple of pillows and I'll slide the person onto the table like this. And what I'm trying to do is trying to accommodate that curve. So I first have people just kind of get settled. Give it a 2 or 3 minutes to see where you're at, because sometimes it's too much. Sometimes you need 3 or 4 pillows underneath you to create more of a curve, depending on how you are, okay? And you're gonna do a little thing I call just kind of propping up. So you're gonna prop up so you're a little bit straighter, and then back down. Give it a couple seconds. It often hurts at the top of the position, so all the way up, and then slowly back down. Okay, series of 10. Feel pretty good. You can have your spouse, you can even try it. Sometimes it's hard to do this if the back is really flared up. You take a pillow out. Now I'll go a little lower. Just let everything settle. Kind of make sure you feel right. Keep yourself flat, head forward. Okay, things are pretty good. The pain's not going further than it was. It may even be coming back into the back and no longer in the buttock. We're going to slowly prop up, come back down. Prop up. And you may notice, wow, it's starting to loosen up. I can go a little further. Eventually, we can take out that final pillow and do a prop up. Now we're actually arching. We're actually the reverse of that C. We're actually going in the right direction. As long as the pain is coming up, there's no pain radiating further down. Prop up, prop up. Eventually, if you're really doing well, and you can't always do this. Sometimes you only can do this particular one and that's all you can tolerate. And then you have to do more later in the day. Like every 2 hours, we'll do 10 repetitions. But if you're doing well, you can then start a gentle press up. So you take your hands underneath your shoulders, slowly come up, pressure on, pressure up. You got to get to the very end of the motion and slowly reduce it. Up, pressure on, pressure up. So how do we get off this table? Then we take ourselves and we slide over, and I like to kind of at least be propped up like this, and we're trying to keep that little curve so we don't flex again, because that's kind of how this got started. Slide off, let one leg drop down, try and push up a little bit, and if you feel all right, you can stand here, get settled. Feel like it's still moving all right, you can do maybe 10 in standing. If it's worse, that's okay, but don't sit down immediately. Okay, you're going to want to, because you just want to get out of this position. It's a new position. Walk around a little bit, get a coffee, just do something, but don't sit down. Keep that upright posture, okay? Limit your sitting to not more than 20 minutes during this stage, sometimes even 10 minutes. You want to limit excessive sitting. So keep this in mind. It's a simple thing you can do. It should not make your condition worse. If it makes it worse more than a minute or two, you have to stop. And then go to the ER or the doctor if you have to. But this might be a simple solution just to get you past the point that you can kind of tolerate a little bit and let a little bit of time elapse. But really combine with that and not sitting more than 20 minutes, sometimes as little as 10 minutes, is the key to kind of jumping past this, and all of a sudden you start feeling better. So keep that in mind. Common case scenario is not lifting heavy objects. Sometimes that's the case. A lot of times it's too much time sitting, and that's when you turn into that C. So let's think about that. Simple progression. 10 times every 2 hours you can do this same scenario. The bed has got a little bit of give, so you may have to use more pillows, and it may be harder to get that press up, but very gradually move into it. And when you're doing that prop I was telling you, you may notice a little bit more pain at the end, but you got to get to the end of the motion and then release it. Okay, I hope this helps you out, and I hope you avoid an ER visit or unnecessary doctor's visit. And just if you like what you saw, and if you haven't subscribed to our station, subscribe here. We got a couple of videos as well, and also like it as well. Okay, so anyway, have a great day. I hope this never happens to you. Okay, take it easy.